Yeah. So can you see the card now? Hello? Hello, Priyanka.
Hello, sir.
Can you see the card now?
Yes, sir.
Yes. Okay, go ahead.
Can I know your name, please, before I
My name
start?
is Abraham Lincoln, and you can call me Mr. Lincoln.
All right. Good morning. I am Imali. I am the registered nurse looking after you today. And I understand why you are here today to your upcoming surgery and your about and your any concerns about you have. And would you all right to talk about it and everything together about what what you want to know?
Yeah, nurse. Actually, I am an apprentice and I'm 25 years old. I have this pilonidal sinus, and it is for excision next week. But I have quite a bit of pain and I am very much embarrassed. I have seen the doctor and he was discussing with me. Okay. Yeah.
Oh, I completely understand about your thoughts, and you're certainly not alone on that way because this is not a rare, and most of the young people have this kind of conditions. So, and you are in the correct place and you took the correct decision. You don't want to worry about it. And these primary sinus are quite common. So you can, after you take this surgery, you can get fully recovered.
Okay, I understand. But nurse, I feel as though I'm very weak and helpless because of this ailment. But I need painkillers more often than I take them.
Oh, I'm really sorry to hear that about your pain, but the pain is real, so you have to control it using these medicals, ec- uh, the painkillers, and so it's cause you to recover and without stress. And when you go to the surgery, uh, then it's the permanent things to recovered for you. So you all been without pain after that.
That's fine, nurse. But I was very much embarrassed when I was with the doctor. Therefore, I did not pay much attention to the doctor when he explained me what a pinoidal sinus is. But I request you, is there any other way out? Can I still find out what a pilonidal sinus is?
Yes, of course. Pilonidal sinus is a small tract. It's under the skin, and sometimes it's based on the spine, and it's sometimes it's blocked with or in fact, it's most often with the hair or some debris. So, and it's lead to pain and swelling. So the surgery is the best option, and so you are in a correct place.
That's fine. I want to tell you, nurse, that I'm very clean actually. I'm very tidy, and yeah, due to my work, I shower in the morning, but I have a bath at night.
Oh yes, I can understand your. I completely understand about your position, but you must understand this is not related to your hygiene, and this condition is often cause of the factors beyond that your control, and it's maybe in fact with the type of hair and sometimes your position and that kind of thing. So please don't be blame yourself, and it's not your uh, not depends on your hygiene.
Yes, of course. I agree with you. And what do I need to do after the procedure?
Oh, that's a very good question. And after the incisions, we will full covered with the dressing your wound. So maybe sometimes you feel it's soreness in few days, and we will fully instruct you how to keep the dressing clean, and the wound is clean and dry, and and we will give you the medication to manage the your wound healing, and we will observe the signs of symptoms of the healing and infection. You might ask about it during when you come to change the dressing. So the most important things you have to avoid too long hours sitting, and always try to keep the area clean, so it's promoting the healing.
Yeah, that's a fine nurse. And I'll tell you from now onwards, I'll follow the doctor's advice, and I'll also listen to the nurse or staff's suggestions when I'm in the hospital, and I'll stick on to the medication regimen rather than suffer pain.
That's good. That's nice to hear about it. But uh, you don't want to worry. After the medical instructions, you will get fully recovered soon and smoothly.
Thank you very much, nurse. I really appreciate your care and concern. Thank you once again.
Thank you so much. We hope to see you soon after surgery.
Right. So that's very nice. Now let's have our feedback. Okay. Um, Imali, Priyanka, this is your second session. Yesterday you had one, and today it's your second session. So you will get courage when you are speaking like this live. And if you can have your video also, it will be better. But you see your chances. It is your choice. It is your choice. So you can see when you see your face live on the video, then you will know what mistakes you are doing, how confident you are. So you are hiding yourself, that means you are shying, you are afraid, or you are scared. But when you're coming openly, you are dynamical, you are acting, you're very active, you are very powerful, you are very strong. So that's up to you whether you want this way or that way. That's no problem. Anyway, it is your choice after all. So because you have your options, and I am ready to accept whatever your options are. Okay, I respect your requirements. So coming to the point, Imali,
Yes, sir.
first thing is the way to OET. There are three patterns OET speaking. First one is if you are an examinee, then I will be an examiner. That means I'm very strong. If you are a student, I'm the teacher. That means I'm very strong. That means in both ways you are very weak, because examinee is scared of the exam and the examiner. Student is afraid of the lessons and the teacher is strong. So both these ways are not suitable. So take the third way. You are a nurse and I am a patient. This is a role play. You are a nurse and I am a patient. You are not an examiner here, you are not a student here. Remember that. You are a nurse and this is a real consultation, and I'm a real patient. Like that, you have to feel. So, who is strong? You are strong. You have 100% knowledge, and I have 0% knowledge. That's why I'm literally begging you to tell me about what is pilonidal sinus. And I'm trying asking you, I'm helpless, and you are the powerful person here. So remember that you are playing the role of a nurse. No, you are a real nurse. That is what it is. So you will be very strong and you will be very confident. Next comes the vocabulary. You're using vocabulary, but that's very mediocre. Mediocre means 250 to 300 marks range. 250 to 300 marks or 350 maximum marks range. So it's not very excellent. You have to improve on this vocabulary. You have to learn new vocabulary. C1 and C2 vocabulary. What are C1 and C2 vocabulary? I'll provide you in my sessions in the group, in the regular students group. I'll provide you. You can learn those words. For example, render, give, provide, offer. Render is the best word. Okay, give, even a primary school student will speak. So give, render, render your help, give your help, or just help. So offer your help is mediocre. The next, grammar. You have some flaws in grammar. You said it's a depend, it's a depend, it depends, not it's a depend, it depends. So be very careful. So you have
Mhm.
some grammatical flaws. I will show you what mistakes you are doing. So you have to check your grammar, and I'll be giving number of sentences. I'm giving you number of I have given you a role play also. Like that, I'll give you number of sentences, number of modals. So there are many modals already in my Telegram channel and what YouTube channel and WhatsApp groups. So you can go through them, or if you want, you can ask me. I'll send them to you, the links and other things. You can watch my YouTube. So speaking, wherever speaking, I'm giving you a lot of points there. The next one, the style, the style which you are presenting. For example, the number of pauses and breaks, unnecessary sounds, pauses and breaks where you don't require. You're thinking, you're imagining, you're planning. In those times, you use gap fillers. I think, I believe, according to my opinion. The most important aspect is like that there are some fillers which you can use when you are thinking. Right. The next
Mhm.
one, unnecessary sounds. So what's the remedy for this? When you don't have any words to speak, you're preparing, you're mentally planning, and you open your mouth, suddenly sounds come. But no, after that, nothing is there. So sound will automatically come. So what you have to do is just to close your mouth or zip your mouth. Don't open your mouth. Only when you're sure you have a word or two flowing in or sentence, then you open your mouth. So that's okay. 1 second, 2 seconds break, no problem. But making some sounds, unnecessary sounds, will be a little bit awkward. So avoid this awkwardness and confusion. What is that? The person who is listening to you will be confused. So don't make any
Mhm.
sound. All right.
Okay, sir.
Then
Okay, sir.
next one is vocabulary. C1, C2 vocabulary. I told you I'll send. Grammatical
Yeah.
structures, I'll send. So fillers, I will send. So these are the three things I'm telling you today. And try to practice. Try to
Okay.
practice. Oh, well, is that clear?
Yes, sir. Yes.
So, was this session beneficial for if you don't remember, if you could not write down everything, no need to worry. You can go to the YouTube and you can listen to the audio video. You can watch the video and you can know what type of mistakes you are doing. And afterwards, I'll provide you the script from the YouTube. I'll collect the script and I'll make it in a format and I'll give you every bit of correction. Every bit of correction I'll give you, from full stops to commas and pauses, breaks, unnecessary sounds, everything I'll give you, so no need to worry. And I'll give you what score exactly you got for this particular for this particular speaking. You might have got a 330 to 350, which is called borderline. Okay,
Okay,
borderline.
sir.
So you have to work on this and you have to improve. And there are many speaking sessions models which I have given sample sessions. If you go to Telegram channel, you'll find just a type speaking, okay, nursing, speaking, and you'll get a lot of models there. Otherwise, you can ask me, I'll send you the links for them. So how was the session useful for you?
Yes, sir. It's very useful. I never understand my weakness points, sir, and that's very good. Before the exams, I can go through those it and I will correct my errors. Thank you
Yeah,
so much, sir.
yeah, you can send. Yesterday I sent one writing task also. You can write that
Yes, sir.
writing test and send it to me, okay? And I'll give you
Yes,
feedback
sir.
today live, okay?
All right, sir. I'll do.
Right. Okay, dear. Have a nice day.
You too. Thank you, sir. Thank you so
Right,
much.
right, right.
Yes.